This news follows a recent report that found that 83% of adults in Canada have a regular primary care provider, which still leaves 5.4 million without one. And joining me now to discuss the situation in British Columbia is Dr. Jennifer Lush, board member of the BC College of Family Physicians and a family doctor. Dr. Lush, thank you very much for being here with us. Now, we've been talking about this issue for years. What's the situation like in BC right now?
Well, we are still very short of family physicians. We don't actually have actual data to know exactly what the number is without a family physician, but we do know from the recent CIHI report that we are still lagging behind Alberta, the Prairie provinces, Ontario, and New Brunswick in terms of people who have access to a family physician here in BC.
Why is it so hard to get enough family doctors where they're needed?
Well, that's a multifactorial question. It's not just a case of compensation. I think unfortunately government was hoping the new LFP model would resolve the issue, and that's but one step in the right direction. Family medicine is a very important role. It carries a lot of responsibility, and we're also essentially running our own businesses. So, family physicians, in order to stay in practice and continue to care for British Columbians, need supports. They need administrative supports. They need clinical supports. We need to be allowed to build effective teams to help look after our patients. And there are other things such as, people often don't realize that family doctors are without extended medical benefits. We don't have access to a pension or sick time, and things that many people in the employment area feel should be taken for granted. If we're asking people to take on this very rewarding career that comes with a lot of sacrifice and a lot of responsibility, then we need to also be giving them the clinical supports, the overhead supports, and the respect of basic employment benefits. And then I think we would see more young physicians choosing this career path.
Now, are there any short-term solutions? For example, there was at one point a push to build clinics where patients could go to speak to any doctor at that clinic. Is that a model that works? Are there other solutions?
Well, unfortunately, the type of clinic you're describing is largely an episodic care model, and that does not lead to good outcomes for patients. The benefit of having a family doctor really lies in the relationship with somebody who knows you and who cares about your health care. So we need to be investing in longitudinal family medicine, whether that's in government-run clinics or individual practices. Family doctors, wherever they practice, need to be supported to continue to care for British Columbians. We need to give them tools to reduce their administrative burden so that we can spend more of our time caring for patients and less in front of a computer or filling out forms.
And now Ontario making the announcement that international students will be barred from applying to medical schools starting in 2026. Could something like that happen in BC as well?
Well, I think, that came out of a desire to increase the availability of medical school training for Canadians and also to increase the family doctor supply. So I certainly laud those motivations. I think the crucial question is not where are people coming from when they enter medical school, but where are they going after medical school? And we overall across Canada need to be increasing our medical school seats. We need to be increasing residency training opportunities, particularly in the field of family medicine. I think we need to ensure that any plan for primary care reform needs to involve physicians. We need to be considering the long view to ensure that we address this shortage. It's unacceptable that 5.4 million Canadians don't have a family physician because, as Canadians, we take our universal healthcare system as a matter of pride. And right now, we don't have universal access.
That is very true. We'll have to leave it there. Dr. Lush, thank you very much for being here with us today.
Thank you so much, Renee.
That is Dr. Jennifer Lush, board member of the BC College of Family Physicians.